Healthcare in the United States is in crisis. It is a crisis of monumental proportion as it includes enormous cost, issues in quality of care, and safety. The United States spends significantly more than many countries that are ranked above it in healthy life expectations. In November 1999, the Institute of Medicine issued a call to action in their report To Err is Human, citing that between 44,000 and 98,000 preventable deaths in the United States hospital are due to medical errors. A more recent report cites 100,000 deaths annually. This is the equivalent of 300 jetliners crashing every year. Each of these errors also has a significant financial impact on healthcare organizations. Taken together, it was estimated in 2010 by J.D. Power to be $1.32 trillion across the industry. This has continued despite monumental efforts to improve safety, systems, and processes. We know that the answer lies within each organization in their leadership, their people, and processes that create the culture and motivators that currently exist. A critical access hospital in the center of New York State has made some great strides. They are ahead of the average hospital in New York on all available public measures. Likewise, the Mayo Clinic continues to lead the way in safety and outcomes. There's hope, as hospitals at both extremes in size and scope have made significant progress. The healthcare industry is still battling a system that expects humans to make perfect decisions all the time. We know that cannot be possible. Goals must absolutely be aligned with the organization's results, and they must be realistic, understanding each employee's strengths and understanding why they do what they do. The environment must be shaped to motivate and employees to take the correct actions each time. We have seen organizations transform their culture by understanding that the systems and processes should be standardized, and the people then do everything possible to prevent mistakes. Simultaneously, they are alert to and expect the possibility of mistakes every time in order to reduce the impact of them. Unrealistic expectations of perfection, while noble, cannot exist and must be changed. Those facilities that reduce morbidity and mortality rates significantly practice the following: align talents with responsibilities, motivate everyone to support a culture of collaboration, don't accept any form of bullying, and understand the value of communication, collaboration, and teamwork. A paradigm shift must occur and be transparent in all that occurs within healthcare. The culture must create, execute, and demand a commitment to collaboration. Relating specifically to quality, patient safety, and errors, employees must view and complete responsibilities using real-time problem-solving and systems improvements when human mistakes happen. Balanced decision-making requires the ability to gather accurate information in a timely manner. This decision-making will result in improved outcomes. An environment that reinforces searching for the guilty only creates and magnifies the problem. Instead, the environment must motivate as many employees as possible and align them with best practices. Doing these things will result in organizations that standardize care or processes based on the best available evidence. They change these processes as the evidence indicates they should be changed. They applaud those who catch errors while learning from them without pointing fingers at those who make the errors. They immediately reassess procedures and processes when errors do happen. They are led by leaders who understand their roles in decision-making and culture setting. They employ collaborative decision-making for teams with input valued from all levels equally and ultimate responsibility on the team leader, and they focus everything they do on the patient. Organizations are groups of individuals. We have seen the difficulties of an organization change significantly as the individuals in the organization changed. Organizations with strong communication across departments and divisions, with a clear understanding of where the organization is headed, are usually led by people who possess strengths in those traits. To put it simply, these symptoms that occur in healthcare are caused by individuals being in jobs that don't maximize the use of their talents and environments that don't motivate individuals to use those talents. Conversely, organizations most often fail to execute and sustain a culture of collaboration when those in lead positions don't know what truly motivates those around them and how they can boost performance and change culture with that information. There are a number of profiles available on the market that allow you to measure the capabilities relative to motivational traits. We have used many, and we recommend one that we think is particularly relevant to healthcare. If you are a healthcare leader and would like to measure your motivators to determine how you can shape your environment to do more with your natural strengths and to influence organizational culture, click here to complete a free profile.